Have you ever felt your heart to race for no reason? Or a wave of dread right before leaving the house? Maybe your chest gets tight, your thoughts spiral, and people just say, relax. But anxiety isn't just nervousness, and it's not something you can just turn off. In this video, we'll go deep, not just symptom checklists and tips, but the full story. From how anxiety forms to what it does in your brain and body to the best therapies we have today. Because if you live with anxiety or treat it, you deserve more than a surface level advice. I'm Dr. Georgia Brunner. I'm a psychiatrist and psychotherapist and founder of Beyond Psychiatry. This is your complete clinical and compassionate guide to anxiety. We'll cover the official definitions, the biology and the psychology, the trauma roots most people miss, and powerful strategy for recovery, including supplements, therapy, and what actually works in life. Let's begin with what anxiety actually is. Anxiety is a future-oriented emotional state. It's your nervous system anticipating danger, whether real or imagined. Anxiety can be mental, constant worry, obsessive thoughts, indecision, physical, tight chest, racing heart, also gastrointestinal problems, sleep disturbances, behavioral avoidance, over control, procrastination, people pleasing. It's often a combination of all three. Fear is what you feel when the lion is in front of you. Anxiety is what you feel the night before going into the jungle. These are some of the classification of the anxiety disorders. First, agoraphobia, with or without panic disorder. Second, social phobia. Third, specific phobia, isolated. Fourth, panic disorder. Fifth, generalized anxiety disorder. Sixth, mixed anxiety and depressive disorder, both together. And the seventh, obsessive compulsive disorder. So now we're coming to the part of symptoms of anxiety disorder. Anxiety can look different for everyone. Common symptoms include inner stresslessness, constant tension, muscle tightness, headaches, stomach pain, nausea, IBS problems, heart palpitations, sleep disturbances, catastrophic thoughts, what if something bad will happen, irritability or emotional reactivity. Panic disorder specifically includes sudden waves of intense fear, chest pain, sweating, trembling, feeling of going crazy or dying. Before diagnosing an anxiety disorder, always rule out hyperthyroidism, hyperglycemia or hypoglycemia, cardiac arrhythmias, asthma or COPD, and also very important stimulant use or withdrawal from amphetamines, cocaine, also withdrawal because of benzodiazepines or alcohol withdrawal, because not all anxiety is psychological. The causes of anxiety. So there are many factors that can trigger anxiety. There are genetics or also certain personalities, unprocessed stress or chronic hyperarousal, learned helplessness or family dynamics, for example, in high criticism. Let me tell you a story, a personal story. I was around 6 years old flying with my mother. She was terrified, white knuckle gripping the seat, worried about crashing. I didn't fully understand what was happening, but my body did. As the plane took off, I felt dizzy, nauseous, disoriented. It felt like something bad was going to happen. That feeling never really left. Even today, when I fly, I feel it, not always in my thoughts, but in my chest, my breath, and my gut. It's taken me years to understand I wasn't just afraid of flying. I was afraid because her fear became my fear. My nervous system learned this is not safe. And that's what anxiety often can be, not just a thought, but a body memory. It doesn't ask for your logic, it plays back what it once learned in moments of powerlessness. But the beautiful part is, just like it was learned, it can also be unlearned. With the right tools, we can teach the body you're safe now, you're not alone anymore. From a psychoanalytic view, anxiety arises when unconscious conflicts such as guilt, rage, or fear of loss threaten to break into awareness. The psyche creates symptoms to bind this danger. So, anxiety is the price we pay for unresolved emotional truth. What's the link between anxiety and depression? Up to 60 or 70% of patients with depression also meet criteria for an anxiety disorder. Why? The same neurotransmitters are involved: serotonin, norepinephrine, dopamine. Anxiety creates avoidance, isolation, low mood. Chronic anxiety wears down the nervous system, burnout, depressive collapse. This is what happens. Depression is often the exhaustion of prolonged anxiety. Let's talk about treatment. Psychotherapy is cognitive behavioral therapy. The gold standard helps identify and reframe distorted thinking. Psychodynamic therapy explores unconscious roots and past trauma. Mindfulness-based therapy builds tolerance and emotional regulation. Medication. I will recommend to avoid benzodiazepines because short term it helps, but long term it doesn't. So there's also supplements that can help: magnesium, L-theanine, ashwagandha, nervous system regulation, breath work, cold exposure, anti-inflammatory diets, stable blood sugar, sleep hygiene, very important. What can also help? Like a daily practice. Here are real daily tools that help not just in theory, but in practice. Daily nervous system check-in. How's my breath? How's my jaw? Box breathing or 4-7-8 breathing. Somatic anchoring, weight blanket, hand on chest, body scan. Write down anxious thoughts, then reframe. Connect with safe people. Limit stimulants, caffeine, news, social media. Sleep and blood sugar, foundational. Anxiety isn't a flaw, it's a signal. It's a language your body learned, sometimes long ago, to stay safe in a world that felt overwhelming. You don't need to erase it. You need to learn how to listen to it, regulate it, and respond in a way that supports your life today. If this helped you, please subscribe. Every week, I break down psychiatric knowledge in a human way. See you next time here on Beyond Psychiatry.